Hello, Delegate Rohrbach and Delegate Fleischauer. Thank you for joining me today. Let's start with what happened this week in the House. House delegates unanimously passed Melissa Smith's Law, which is named after a hospice nurse that died from COVID-19. Delegate Rohrbach, you co-sponsored this bill. Just tell me a little bit about it.
Well, I did, and thank you for having us. Melissa Smith, unfortunately, was a young lady who was a hospice nurse, as you said, and died of complications of COVID. It's a tragedy, and the real tragedy was amplified by the fact that her family was unable to go to the hospital and visit her in her last days. So what this bill does is it basically makes visitation from your family and or clergy a right. And now people still have to wear the appropriate protective equipment if they go to visit their loved ones, but it does give them the right to go. And I think that's very important because I don't think any of us were happy with what happened, and hopefully, we'll never see it again.
Yes, and that did pass unanimously, so it did have Democrat support and Republican support. So let's move on to some other bills. The two of you are sponsoring a bill together that would curb the cost for diabetes medication and equipment. Legislation last year capped co-pays for insulin at $100 per month for certain health insurance plans. Delegate Fleischauer, what does this new bill hope to accomplish?
Well, I'm very excited about this bill. It would change the co-pays to $25, $25, and $100. $25 monthly for insulin, $25 for non-insulin, and $100 for equipment and supplies. And that could really very much help diabetics, especially those who are type 1. You can have some very, very serious complications from diabetes, and if you have pumps and continuous glucose monitors, you can extend lives by years and years.
And you mentioned pumps, glucose monitors. Just very briefly, give me a sense of what is this equipment that's available, that's on the market that people need?
Well, it's really amazing. You can have a pump and a continuous glucose monitor that basically replaces your pancreas, and it will give you injections during the day to make sure your diabetes is controlled. If you eat, it will do things kind of automatically. You'll have a little monitor that you can see how you're doing. You may need to do some test strips to make sure the monitor is working, but it really is. Diabetes, especially for type 1s, can be very hard to control. If they have a cold, they can go to the hospital. And this means they are going to be more even. And, we heard from people, it used to be that diabetics would die in their teens. And now I know several that are in their 70s and are hoping to make it many more years.
The diabetes bill no doubt focuses on keeping health care affordable, but there are plenty of other proposals, some that are getting even more traction, that would also reduce costs to consumers. Delegate Rohrbach, discuss some other affordable health care bills.
Well, I think one of the more important bills that's a direct help to most consumers of health care is the prescription benefit plan bill that we have. That bill is looking at the rebates that a lot of pharmaceutical manufacturers give for their medications. Now those rebates go typically to the PBM. What we're proposing is that those rebates go directly to the consumer at the point of sale. So right there at the pharmacy, if there's a 50% rebate, then the consumer's going to get that rebate right there at the point of sale. That bill is now in a conference committee between the House and the Senate, so hopefully we can get that bill really ironed out here in the next few days. There's a hospital price transparency bill that I think will help patients to frankly comparison shop a bit. And that bill is still working its way through the House and the Senate, and we're ironing out our differences. Telehealth, I think, is another bill that should help bring health care costs down, and it will certainly increase the accessibility. And another bill that just actually passed out of House Finance just a few minutes ago is a bill that I sponsored about extending Medicaid coverage for 1 year postpartum for our pregnant women. And as we know, our friends in the obstetrical world will tell us that almost all the complications in pregnant women invariably happen in the year postpartum. So if we can cover them, they'll have better access to care, and the way that saves money is you should have much less rate of serious complications. So and healthier families and healthier women. So I think those are 4 significant bills that will help to bring the cost of health care down and improve accessibility.
And you did say that Finance directed, they recommended $1.4 million go towards paying into Medicaid for that bill if that were to pass.
That was correct. I just came from that meeting at 4 o'clock, and you're right. They approved a fiscal note of $1.4 million into the budget, and that's going to the House floor tomorrow.
And Delegate Fleischauer, you also sponsored that bill. Anything else you would like to add?
Well, I think there could be, it could cost less than that because the matching federal funds. But I think it's really important that when we have moms and babies that are trying to get through, right now Medicaid only covers 60 days, and this would extend it to a year. And it will really mean healthier moms mean healthier babies too.
We've discussed bipartisan bills so far, but many health issues have been contentious on the House floor. Delegate Fleischauer, as a member of the minority party, how are you feeling so far in this session, and what legislation are you most concerned about that Republicans could push through?
Ooh, that's a hard question. It's pretty hard to be in the super minority, and there have been some demoralizing debates. But I tend to, and so does Delegate Rohrbach. You work on one issue, then you move on to the next one. And one that I'm worried about that's coming up is Senate Bill 334, which is about the syringe exchange. We have a very successful program in Morgantown where we give clean needles out to people that have drug addictions. And you know, I gotta say, we have the largest opioid addiction in the country here, and we cut back on access to opioids. And so what did people do? There was a new market created for illegal drugs. And so we are trying with our program, and there's a good program, I believe, in Cabell County also, to get these people into treatment and into make sure they're taken care of, because we now have, we are number 1 in opioid deaths, we are number 1 in Hep C and Hep B cases, and we have 2 outbreaks that are 2 of the 4 in the largest outbreaks of HIV in the country. And that's what happens when you don't use clean needles. The problem with 334 is it doesn't follow the science. So the program that we are following, and probably Cabell County too, follows the CDC recommendations. And this bill would say it would be illegal to follow the CDC recommendations. And so that's what we're worried about, is that these successful programs that are helping people get into treatment, if they don't get into treatment, they can have very, very serious complications like endocarditis that we will all pay millions for because they'll need hospitalization for it.
Delegate Rohrbach and Delegate Fleischauer, thank you for your time today.
Thank you, June, for having us.
Yes, that went quickly.